Let's go to Florida and see what Susie's up to. She's been holding on forever. Hey, Susie, thanks for the phone call. You are live.
Hey, Dr. Clay, how are you?
I'm great, but hopefully I'll get better. What's happening?
What do you do for sinus infection, and what causes it?
Cut your nose off, cut your face off, cut your sinuses out. That's what the MDs recommend, right?
Yes.
I mean, right? Right?
That's correct.
Got to ream that sinus out, get the drill out. You know, let's go down to Home Depot and get the 1/4-inch drill bit and just shove it up there. It's nuts what they do, right? So from our point of view, chronic sinusitis can be involved with a number of things, right? But one of the things that nobody talks about, and the main thing, of course, which I'll roll around to at the end, is, you know, medical nutrition. We have to make sure that the sinus cavity is properly nutrified. Because if the sinus cavity doesn't have the nutrients that it needs, it's going to get funky, it's going to get dried out, it's not going to work the way that nature intended it to. And then all manner of weird things are going to start to happen to it. It's kind of like if you had a man-made pond in your backyard, or a pool. You put a pool in your property, and you know, when you have pools, there's a source to bring good water in, and then the old water drains out and goes away, so the water is always refreshed. And if you're smart, you have a sprinkler or something in the middle of the pool to keep the water moving. Well, if the intake or the outtake of the pool gets jammed up, or the electricity to the sprinkler goes off, to the fountain goes off, now all of a sudden you have stagnant water in your backyard. And if you have stagnant water in your backyard, guess what you're going to have next? Mosquitoes, right? Because mosquitoes breed in stagnant water. So when the environment of the body goes south, any number of bad things start to happen, because that's life. And, you know, there was a very famous argument that existed back in the day when Louis Pasteur discovered germs. Louis Pasteur said it's the germ that's the thing, and the terrain or the environment of the body is irrelevant. That if you're exposed to a germ, it's going to gain a foothold, it's going to take over, and you're going to be SOL. On the other side of the argument was a man named Beauchamp. I forget his first name. Maybe Jean-Claude, but I just made that up. His name was Beauchamp. And Beauchamp argued that it's not the presence of the germ that's the problem, it's the environment of the body that gives the germ a place to live or not. And there's this raging argument for years. It still exists, quite frankly, and it's kind of like the nature-nurture argument inside of psychology, right? You know, what is it that determines behavior? Is it your genetics, or is it how you're raised, right? Which one is it? Is it nature, or is it nurture that forms your personality? It's still an argument today. Well, on Louis Pasteur's deathbed, right, Louis Pasteur, the guy that discovered germs, he recanted and said it's not the germ, it's the terrain of the body. The terrain is everything. Now, interestingly enough, the pharmaceutical industry didn't want to hear that, and so they swept that one under the rug, and they went to the races to develop drugs to kill the bug, rather than to deliver therapeutics to make whole the environment of the body. Because our entire position is, if the body is healthy, there's no room for the bacteria, the mold, the yeast, the fungus, or the cancer cell to grow. It's just not there. It's not possible. There's a trillion, gazillion, bagillion mosquitoes in the world, but if there's no stagnant water in your house, there's no mosquitoes in your yard, because mosquitoes need stagnant water to live. It's the same with the sinus cavity. So we must nutrify the sinus cavity, and we do that with extra essential fatty acids on top of the healthy start pack. So, you know, the most economic way to do that then would be with the healthy brain and heart pack, because the healthy brain and heart pack has the 90 essential nutrients plus extra EFAs plus extra selenium, which is never a bad idea. So in order to secure optimal function of the sinus cavity, that you give the 90 for life, appropriate for body weight, little extra selenium, and a little extra EFAs, or a lot extra EFAs. You can mess around with that. Another interesting factor related, I believe, to chronic sinusitis is chronic dehydration. Because if you're dehydrated, your sinus cavities and your upper respiratory tract is going to be affected first. It's going to dry up. So if it dries up simply because you're dehydrated, then the environment of the sinus cavity is not going to be optimized, and bugs are going to be able to gain a foothold and grow simply because you're dehydrated and you didn't know it. Now, kind of an old-fashioned down and dirty. Actually, this is not, I just lied. I made this up. This is a Dr. Glidden thing, right? I made this little test up. One way to test for dehydration, it's harder for women to do this, but you can do it. In one 24-hour period, every time you pee into a cup and measure it. Measure how many ounces you pee out. And in the same time period, measure in ounces how much liquid you drink, whether it's juice, beer, wine, coffee, tea, milk. If it's a liquid, you measure how many ounces before you drink it down, and then at the end of the 24-hour period, you see if you peed out more ounces than you drank down. And if you did, you're dehydrated, right? That's pretty simple math. Now, there's one more thing that can be contributing to chronic sinusitis. And nobody talks about this except naturopaths and a few enlightened chiropractors. If you look at if you were to peel somebody's face back, peel the muscles back, and look at a living skull, not a calcified skull that's sitting in the corner in your high school biology class, right? Stony hard. But if you were to look at a living skull, you know, in Technicolor, it exists with all of these puzzle pieces that are interlocking together. And I forget off the top of my head how many bones are present in the skull and the sinuses, which all fit together like pieces of a puzzle. And it's a fluid thing. It's not this stony hard rock thing like the skeleton hanging in your classroom in your high school or college. It's not that at all. Living bone is very, very different from Mr. Bones hanging in the classroom. And if you've had a trauma to your head, you know, like you were a kid and you know, you fell out of the carriage onto your face, or somebody punched you and you broke your nose, or you were playing volleyball and somebody, you know, smashed a volleyball into your face, or you were riding your bike and fell onto your cheek, or whatever, right? Historical trauma can tweak the articulation of the bones in your sinuses, which you would never ever know. You would never know, because you just kind of get used to having the bones in your sinuses be incorrect, be not the way that they should be. I don't know if you've ever been to a chiropractor, but if you have a backbone that's out and you get a good chiropractic adjustment, it's like, oh my God, right? It's like, holy crap, what a difference that makes. Well, sometimes with chronic sinusitis, it's the anatomical architecture of the sinus cavities themselves that's the problem. So there is, interestingly enough, a therapeutic course of education that trains people in how to assess this and fix it if it's a problem. It's called craniosacral therapy. So my advice to anybody who's suffering from chronic sinusitis, especially if you've had the ream job surgery, find a certified craniosacral therapist. Tell them I sent you. Tell them you have chronic sinus condition and have them do an assessment of your sinus cavities. And if I'm right, and there's something not right there, and the craniosacral therapist can fix it, oh man, I mean, that's like gold, baby. I mean, that's like, I mean, it's quite remarkable. Does that make sense?
Yes, it does. Thank you.
I think I'm talking too much, Susie.
No, that's okay.
I kind of get the sense. I'm on a roll yesterday and today. How long have you been dealing with chronic sinusitis?
It comes and goes.
Is it worse seasonally for you?
It doesn't make any difference what season it is.
Yeah, so winter, spring, summer, fall. Do you remember any type of trauma to your head or face when you were younger?
No. Mm-mm.
You never had an automobile accident where the airbag deployed? Nothing like that?
No. Mm-mm.
Okay, so I would have it assessed anyway. Well, so given that history, then what I would do is I would do the extra essential fatty acids, make sure you're hydrated, and I would do that for 3 to 6 months and see whether or not you get on the other side of the sinus condition. If you don't,
Okay.
then we must consider that it's an anatomical thing and go and see somebody and have it checked out. Okay?
Okay, great. Thank you.
All right, Susie, appreciate you.